When I have cold and flu, I tend to try and crack on through my day. I find staying in bed makes me feel worse. If I do something, it kind of gives me a bit more energy.
When I have the cold or the flu, I found that in the past, because I get it so regularly, if I try to go to work with it, I actually stay sick a lot longer. So I'm more to stay home and I'll just keep to myself and have a couple of days rest and have some medication. I'll find that I'll recover better if I have those couple of days, rather than if I just push through it and keep going, I'll stay sicker a lot longer.
I don't really know how the medicines work, but what I tend to look for is branded on the packet which suit the symptoms that I have when I have cold and flu. I normally treat it by taking some type of cough sweet. I will also use nasal sprays and hot drinks with kind of like a paracetamol powder to them.
I find the best way to treat my cold is definitely with the decongestant cold and flu tablet. I find it really clears me up and it gives me the ability to at least breathe a bit better and continue with my day if I have to keep going. They've also got the paracetamol in them, so I find in conjunction with a cough medicine, I find that's the best way to treat myself. With the treatments I do use when I have the cold and flu, although they do work, I actually have no idea how they work.
When I have cold and flu, I wouldn't tend to go and see my doctor. I'd go to the pharmacist and ask for advice on what type of medicine or medication I should take, as this is easier and faster and more accessible. When I have cold and flu, I'd usually wait a couple of days before I go to the pharmacist. This is just to see how it develops, and if it gets any worse, then I will seek medical help from the pharmacist. When I go to the pharmacist, I usually ask them for help on what kind of products I should be taking to my symptoms to help with cold and flu.
If I have the common cold, I'd just self-medicate, head to the local pharmacy and get myself some decongestants and some cough medicine or some paracetamol. If I do have a flu, it's definitely I would go to my local GP, get a course of antibiotics. I find that it does knock your body a lot around, so you do need obviously a course of antibiotics and some painkillers.
If the doctor was to give me antibiotics, I'd be happy to take them if they ensured that I recovered quicker by taking these than other medications. I don't think that antibiotics are needed for all types of cold and flu. I feel that they'd only be needed if symptoms were really bad.
Yeah, I'd be quite happy to take antibiotics for the cold or flu if the GP offered to me. I find with the common cold, I don't take antibiotics. So with the flu, every time I would have the proper flu, I would get a course of antibiotics.